lot of this should be a review at this point. Okay, so if it is not for you, if you did, especially if you did Bio 150 online, if you didn't learn it very well the first way through, get with your classmates who learned it better, because you need to know this stuff like by today, okay? So really this week, make sure you understand the basics, and then, come next Tuesday, we're hitting the ground running. So make sure you understand this stuff. If you have questions, ask, okay? So our objectives for today: 1, define kinesiology, describe its basic principles with related key medical terms. Number 2, describe osteokinematics through the application of planes and axes. Number 3, summarize your basic concepts of kinetics and biomechanics, including forces, torques, lever, and how they apply to physical therapy. That one specific is not something that we covered in Bio 150, but you should have gotten it through, physics classes or high school chemistry, those types of things. I'm going to pull out a couple important principles for you guys to learn, but also I'm not a physics major. Don't expect you guys to be physics majors aside from our one engineer in the class. This is not something that we will spend, a lot of our time and energy and focus on in our profession. But since it's a basic concept, we do have to go over it. But I'm not as, heavily focused on that compared to the other things we're going to talk about. Number 4, exhibit a thorough understanding of the convex-concave rule and apply that information to describe the arthrokinematics at each joint. Okay, this is going to be our newest content for today. So again, we're going to take what you learned in Bio 150, add a new principle on top of it, and then that is going to form the foundation for basically the whole semester in terms of our arthrokinematics. That's going to be something that comes up in every single joint. And then that's going to come back next semester in assessment, the following semester in orthopedics. Orthopedics is where we will really apply this foundational information that we're going to talk through today. Okay, so again, you have to learn the basic conceptual rules so we can then build upon it. Okay, so just starting first with your definition of kinesiology. Okay, so kinesiology is basically the study of movement. Okay, but this is a very broad definition. Really, kinesiology is going to bring together several different fields of science and of math, and then relate them to human movement. Okay, so we define kinesiology as the study of movement through the application of anatomy, physiology, physics, and mechanics. Okay, so before we get into anything else, I want to make sure we go over descriptive terminology. Make sure you guys know these terms, because again, this is the language that we're going to use, that we're going to speak in, so we just expect you to know it. So again, now is the time. If you don't know what these things mean, we need to talk through them. Okay? So what is supine? Laying on your back. Okay, what about prone? Laying on your stomach. Sideline. Laying on your side. Anterior, toward the front. Okay, posterior, toward the back. Superficial.
Most of the surface.
Towards the surface. Okay. What about ventral? Towards the front. Okay, so that is going to be a synonym of anterior. What about dorsal? Towards the back, where your fin is. Okay, synonym of posterior. What about deep? Away from the surface, more internal. Okay. Medial. Towards the midline of the body. Lateral.
Away from the midline.
Away from the midline. Okay. Superior. Top, toward the head, or located above another surface, just depends on what you're referencing. Okay, what about inferior? Below, okay? Inferior to another structure, below another structure. What about cranial? Toward the head. Caudal. Toward the feet. Ipsilateral.
Both sides.
Ipsilateral is same side. Same side. Okay, so My left leg is ipsilateral to my left arm. It's on the same side. Okay, what about contralateral? Opposite sides. My left leg is contralateral to my right arm. Okay? Bilateral.
Both sides.
Both sides. Unilateral.
One side.
One side. Proximal.
Near.
Toward the
Yes.
front. Toward the front.
Closer toward the center of the body. Okay? And then distal.
Away from the center of the body.
Exactly, away from the center of the body. Okay? Anything you would like me to repeat there? Any questions you have? And we can go over these again in lab if you don't want to ask right now too.
When you said cuddle, you said feet?
Yeah,
It's
closer
not,
toward-
not
so-
the tailbone?
Tailbone, but also we go more distal than that.
Okay,
Yeah.
yeah.
Anything else? Okay. All right, so going through some of our basic terminology here, just your basic principles. Again, these are just important concepts that you guys have to understand conceptually. So starting first with mechanics, okay, that's just going to be the study of forces exerted on an object, okay? And then biomechanics is going to apply that information to human movement, okay? So we have two separate divisions of biomechanics, which include kinetics and kinematics. So kinetics is going to look at how things like these forces and torque influence the body, okay? So for example, the force of a muscle contraction, what does that create on a bone, okay? And then kinematics is going to be how these things actually create motion. So here with kinematics, you have to consider the components of time, space, and mass of a moving object or a moving system. Okay, so we're gonna break these up a little bit more. First, starting with kinetics, okay? So again, we're not in a physics class, we don't have to go super in depth here, but just understand your basic principles of force and torque and how these things might influence your treatment and your exercise prescription. Okay, so there's four main types of forces that we're gonna cover, okay? So in general, a force is going to be the amount and direction of a push or a pull that is applied to an object, okay? So if we apply that to gravity, we have gravitational force, and that is going to refer to the amount of force that is exerted on an object or a person as a direct result of gravity, okay? And this is probably gonna be the most important one that we have to consider, because gravity is always pulling from the same spot, right? And our muscles are oriented in different directions. So we have to understand how to contract our muscles using gravity as our resistance, okay? And I know I touched on a little bit on this in our Bio 150 class, but your biggest example here is if I want to strengthen, let's say, my external rotators of the shoulder, okay? I can't stand like this and go into external rotation. I'm not gonna strengthen anything that way because gravity is pulling straight down toward the ground. Okay, so if I wanted to strengthen here, I would have to lie on my side and then externally rotate, because now my gravitational force is pulling and my muscle is exerting its strength against that force. Does that make sense? Okay. So, and again, through this semester, that's gonna be a big part of your practicals, is how do you contract a muscle isometrically, concentrically, and eccentrically, okay? So, as you start to learn the different muscles, those are things that you have to be able to think about and then apply this concept to. Okay. All right, we also have linear forces. So a linear force is where two or more forces are acting on the same line, okay? So basically, two people pulling the same thing in the same direction. That'd be an example. Parallel forces, you have two or more forces acting on the same plane, and that could be in either the same or opposing directions. Okay. We also have concurrent forces. Okay, so here you have your two forces pushing or pulling in different directions. Okay, So they could have different magnitudes, directions, points of contact. They don't have to be the exact same things. And then that is going to lead to a resultant force. Okay? So this one is something that we will see in especially the deltoid muscle. Okay? Because if you think about it, your deltoid muscle has 3 different heads. Okay? You have an anterior deltoid, a middle deltoid, and a posterior deltoid. And they all have some, similar actions and then also different actions. So your anterior deltoid does flexion, middle deltoid does abduction, posterior deltoid does extension. So if all 3 of those things contract at the same time, let's say it's this. So look at this diagram here. If this is anterior deltoid, this is posterior deltoid, this is middle deltoid. Or even if you're just considering anterior and posterior, when all of them contract, you're going to get a resultant force in the middle. Okay? So that is your example of a resultant force. We also have force couples. Okay? So this is also depicted here as well. And this is going to occur when you have multiple forces that are going to result in a rotary motion. Okay? So this specifically we have, I don't know if you can really see that diagram well, but you have your upper tract, your lower tract, and your serratus anterior. Okay? All 3 of those muscles, when they contract together, they result in an upward rotation of the scapula. Okay? So that is an example of a force couple. You have 3 different muscles pulling in totally different directions, but you have that resultant movement of upward rotation. Okay, so it's resulting in a rotary motion. That's a force couple. Okay, so next we have torque. So torque is force that produces rotation around an axis. Okay, there are 2 variables that contribute to the amount of torque that is generated. So number 1 is the amount of force that is actually exerted. And then number 2 is the distance that force is applied from the axis. Okay? We also have an A on here, which is your moment arm. So the moment arm is the perpendicular distance from where the force is applied to the axis of rotation. Okay? So in the actual body, this is going to be the perpendicular distance between the muscle's line of pull and the actual center of the joint. Okay. Now in order to calculate torque, you would multiply the amount of force times the moment arm. Okay? So it's down there at the bottom, T equals F times NA. Torque equals force times the moment arm. Okay. So now with that, you just have to consider how you could potentially manipulate this. Okay, so you could increase the torque by either increasing the amount of force that's applied or the length of the moment arm. Okay, or both. Okay, so a good anatomical example here is going to be your patella. Okay, what's your patella? Your kneecap. Okay, so you have your quadricep muscle, goes over top of the patella, and then where does it insert? Say it. The tibial tuberosity. So quadricep muscle turns into the patellar tendon inserts into the tibial tuberosity. Okay? By having that patella present, you are now increasing the moment arm. Okay? So the quadricep, because that moment arm is increased, is able to produce more force. Okay? Or generate more torque. Okay? So again, that was the highlight reel. Try to keep it simple. Don't get confused. Okay, so now we are going to move on to kinetics. Okay? So this, again, you are now taking into consideration your components of time, space, and mass of a moving system. Okay? So, fast. So our 2 big categories for kinematics is going to be osteokinematics and arthrokinematics. Osteokinematics is going to look at the relationship of the movement of the bones around a joint axis. Okay? So this is considering movement of a bone in a particular plane on a particular axis. Okay? So we're going to go through that in just a little bit. And then we have our arthrokinematics. Okay, arthrokinematics discusses and describes the movement of your joints in relation to the actual joint surface. Okay, so this is joint surface motion. So these terms are going to be things like rolling, sliding or gliding, okay, and spinning or rotating. Now, in order to describe the organization of the human body, we have to have an arbitrary starting position, okay? So anything that we talk about in terms of your osteokinematics is going to start from this position, okay? So again, this is your anatomical position. So here, you're either standing or lying in an upright position. Feet are about shoulder width apart, facing forward, and then the arms are down by the side with the palms facing forward, okay? The difference between this and a functional position is just that the thumbs are facing forward opposed to the palms, okay? But this is really the one that you need to know. Okay, so here are examples of your osteokinematic motions, okay? I tried to list them out for you as best as I could between this slide and the next. But again, hopefully these are already things that you guys should know. We are going to go through them right now. We'll also go through them again in lab to make sure it's solidified. And then again, if you still don't understand it after lab, come and talk to me. I want you guys to know this by today. Okay? Everybody stand up. We're just going to start at the neck. All right, let me see cervical flexion. Cervical extension, cervical side bend, cervical rotation. These are your scapula, okay? Scapular elevation, scapular depression, scapular protraction, scapular retraction, scapular upward rotation, scapular downward rotation. Okay, let's go shoulder flexion, shoulder extension, shoulder abduction, shoulder adduction, shoulder horizontal abduction, shoulder horizontal adduction,
Smack somebody.
shoulder external rotation, shoulder internal rotation, elbow flexion, elbow extension, forearm pronation, forearm supination, holding the bull suit, wrist flexion, wrist extension, wrist ulnar deviation, wrist radial deviation. All right, let's go trunk flexion, trunk extension, trunk side bend, trunk rotation, hip flexion, hip extension, hip abduction, hip adduction, hip external rotation, hip internal rotation, knee flexion, knee extension, ankle dorsiflexion, ankle plantar flexion, inversion, eversion. Okay, partner up with somebody that you are not super close with and run through all of those motions. I know, I can see some of you know them better than others. So if you are somebody that does not know these well, try to find somebody who knows them. If you still don't have it down right now, don't be stressed about it. We'll make sure you get it by the end of the week. Okay? So I just wanted to briefly review because now we're going to go through your planes and your axes. You have to understand the motions to understand how they occur in these planes and axes. Okay, so what are our three cardinal planes?
Transverse, frontal, sagittal.
I still didn't hear that with confidence, but that's okay. So we have our sagittal plane, our frontal plane, and our transverse plane, okay? So if you look at these colors, this is basically how the body is divided, okay? So sorry, I'm getting a lot of emails. Our sagittal plane is going to pass basically through the body and divide it into equal left and right parts. Okay, so that's your blue picture on the ends. So if you took a big, panel, piece of wood, mirror, however you want to imagine it, the wall. A lot of people like the wall for some reason. But if you put it straight through the middle of your body, that's your sagittal plane, divides the body into left and right halves. Okay? The frontal plane, it's going to come through this way. So it is dividing the body into a front and a back. Okay? And then your transverse plane is going to cut the body in half and divide it into a top and a bottom. Yeah.
Yeah, the sagittal plane is correct that we say sagittal, or we have to say mid-sagittal plane?
No, just sagittal plane.
Okay.
Yep. Okay, does that make sense? Okay, so now all of your motions are going to occur in a specific plane around a specific axis, okay? And that information does not change. So once you understand which motions occur in which plane, around which axis, that doesn't change, okay? So, here, let's go through the axes first, and then we'll talk more about that. Okay, so then we kept our planes and our pictures, and now we have these little dotted lines, which are now our axes. Okay, so we have 3 axes. What are those called?
Frontal axis, vertical.
Yeah, well, you're kind of right. You have the frontal axis, the sagittal axis, and the vertical axis. Okay, so one term is a little bit different there. Okay, so your sagittal axis is going to run through a joint from the front to the back, okay, or anterior to posterior. Your planes are just looking at the body as a whole. The axes are individual to each joint. Okay, so if I took my sagittal axis and I'm talking about the shoulder, my sagittal axis is going to go through my shoulder from the front to the back. Okay? Frontal axis is going to run through a joint from side to side, okay, or medial to lateral. Okay, so if again I was talking about my shoulder, it's going to come through this way. Okay, and then vertical axis is going to run through a joint from the top to the bottom. So it would be right here. Okay, any questions on your straight just definitions, what these things are?
Bless you.
Okay, so again, joint motion is going to occur in a plane around an axis. Okay, so if we want to talk about, let's do, I think the frontal plane is the easiest to understand, in my opinion. So let's take this picture here. We have the frontal plane. Where does the frontal plane run? What does it divide the body into?
Front and back.
Front and a back. Okay? Your frontal plane is always going to be associated with your sagittal axis. Okay? What's the sagittal axis?
Runs from the back.
Axis that runs
Straight in the middle.
Okay, so it's gonna run through a joint from the front to the back. Okay? So right now, frontal plane, sagittal axis at my shoulder. So if I think about this as actually going through the joint, okay, there is only 2 motions that could occur here. What do you think they are?
Abduction.
Abduction, adduction. Okay? So that's what that would look like. Okay? I don't know what the little thing is.
Foosball.
Huh?
Do you remember the
Foos-
foosball?
it's
example?
foosball.
Oh, the foosball example. Yes,
Yes.
that was a
Yeah.
great example.
Yes.
Think about it like foosball.
You got your little guy on his
Mhm.
pole. He's only swinging
You can only
one
go this way.
direction. He can't bend to touch the
He's
pole.
here. You move this axis, he's gonna swing like this. Okay? So that's going to be abduction, adduction. Okay? Frontal plane, sagittal axis. Abduction, adduction.
But I think so would be the blue sagittal plane, the football would be in that way.
Yeah, essentially the foosball guy
The
is
foosball would
the
be the
frontal
blue.
axis.
Yeah, because he
Yes,
faces,
because he
Technically.
hit it in the
he's got to face
Yeah.
the wall.
sagittal plane.
Yeah.
The ball is here.
Oh, I see what you're
I
saying.
think. Mhm.
Yeah,
Actually,
scratch
the-
that. Foosball is that one. Okay,
move your
but
bio.
without the foosball analogy, does that make sense for your frontal plane sagittal axis?
Yes.
Okay, so then let's take that, we have our sagittal plane, frontal axis. So where's your sagittal plane? What does it divide the body into?
Left and right.
Side and side.
Left and right. And then your frontal axis goes to this way. So what motion is gonna occur here? Flexion extension. That would be your foosball. Okay. All right, and then we have transverse plane, which is what? Divides in the top and bottom. Vertical axis. So if we use our shoulder, what motions do you think is gonna occur here?
Rotations.
Any rotational movement is always going to occur in your vertical axis transverse plane. So in your shoulder example, that's going to be your internal or external rotation. Okay? So again, those things do not change. Also, horizontal adduction and abduction will occur in your transverse plane around the vertical axis. Okay? Same thing with your pronation, supination. So any type of rotational motion occurs here. Okay? So we're gonna keep going, but again, that's something that we will come back to and review more of if we have time in this lecture or in lab. Okay? Next we have what is called degrees of freedom. Okay, this basically describes the number of planes and axes that a joint can move in. Okay, so we have number one here is uniaxial joints. That means that it has motion that occurs in one plane around one axis. Okay, so these are going to be things like your hinge joints. Okay, what's an example of a hinge joint? Your elbow. You have elbow flexion, elbow extension. It's not going to do anything else. So it has movement in one plane around one axis, making it a uniaxial joint. Okay. Next, we have biaxial joints. Okay, so what do you think that means? Two. So it's going to have motion in two planes and around two axes. Okay, so this would be something like your wrist. Okay, what motions do we have at the wrist? Flexion, extension, ulnar, and radial deviation. So that means we can move in two planes and two axes, making it a biaxial joint. Okay? And then lastly, we have triaxial joints. So you have movement in three planes and three axes. These are going to be things like your ball and socket joints. Okay, so think your shoulder, your hips. At the shoulder, we have a ton of motions, right? Flexion, extension, adduction, internal, external rotation. Three planes, three axes, triaxial joint.
We talk about this only in anatomical position. Do these planes and axes change depending on where my arm is?
So in terms of actual memorization, it's always going to occur in the same plane and the same axes. But if you really try to reason through it, you can kind of go down a deep rabbit hole there, so don't worry about that. Okay. Okay, so that was, big summarized view of your osteokinematics. Now we're gonna move over to your arthrokinematics, okay? So again, this is now looking at the motion of your bone surfaces during joint movement, okay? So the first thing to talk about here is going to be your joint congruency, okay? Joint congruency basically just means how well a joint fits together, okay? So we have two primary positions when it comes to joint congruency. We have an open packed position and we have a closed packed position, okay? Closed packed position means that the joint is very congruent, so it's fitting very tightly together, okay? Your joint surfaces have maximum contact with each other, okay? They're tightly compressed, it's difficult to distract or difficult to separate. The ligaments and the capsule are holding things together very tightly, okay? Now, this typically occurs at the extremes of range of motion, okay? Now, every joint that we are going to talk about will have a specific amount of degrees for certain motions where it is in its open packed position versus its closed packed position, okay? So as we go through the different units, those are things that you'll have to memorize. Okay, but for now, I just want you to understand what they are, okay? So on the other end of that, you have your open pack position. Open pack meaning that there's minimal congruence in the joint. Things are much looser, they're not tightly packed together, there's more space, okay? There's more laxity in the ligaments and in the capsule, okay? So again, closed pack position, everything is very tight, very congruent. Open pack, everything is very loose and lax. Okay, your open pack position is important because once you guys start learning your joint mobilizations are supposed to be performed in your open pack positions. Okay?
Can you show that like at the knee, just an example?
The knee will be hard to visualize.
Okay.
Let's
What-
do, let's do the hip, okay? So at the hip, your maximum open pack position is going to be 30 degrees of flexion, 30 degrees of abduction, slight external rotation. So if I wanted to do like a joint mobilization or a distraction, I'm gonna have somebody laying in that position where I'm holding at their ankle, I go 30 degrees of flexion, 30 degrees of abduction, slight external rotation, and then lean backwards. Okay, so that's gonna be your open pack position, okay? Versus if I wanna close down the joint, are you looking at it this?
Yeah, I took next on it.
Okay, that's gonna basically be your opposite motions compared to that position. So we're really going to go into hip extension, adduction, and internal rotation in order to lock down the joint. So it's really tight in that position. Okay, so again, don't worry about those specifics for right now. We'll learn those as we go. Just make sure you understand the differences between the two concepts right now.
It doesn't have to do with extreme range of motion in as far as it can go one way versus as far as it can go.
Not necessarily, no.
Okay, I got that wrong. Thank you.
Okay, arthrokinematics. Okay, so again, think joint surface motion for arthrokinematics. The first step in understanding this is knowing the shapes of your bone ends. Okay, so if I have, let's take a humerus, okay? If I have a humerus, you guys need to have a mental picture of what this looks like, okay? What does the shape of that bone look like at the end, at the top, and at the bottom of it, okay? Every single bone, you have to be able to see that, okay? What you need to know about it is if the shape is convex or concave, okay? Concave, you're gonna use your hands a lot as your diagram. So everybody hands up. This is convex, okay, it has curvature. This is concave, it makes a cave, okay? They fit together, okay? Every joint will either have one end that is convex and one end that is concave, or vice versa. So you have to know which bone is the convex bone, which bone is the concave bone. Any questions there? Are we sure? Because it's gonna get more complex in a minute, so. Okay, all right, so. Your big terms for arthrokinematics are going to be roll, glide, and spin. Okay, glide you'll also hear sometimes it called slide, but I would say glide is more common. Okay, so again, we're talking about the joint surface motion here. This is much more difficult to see and to visualize as compared to your osteokinematics, which are your big motions. Okay, so your first one here is a roll. Okay, so a roll is the literal rolling of one surface on another surface. Okay, so basically new points on one surface contact new points on an adjacent surface throughout the entire motion. So if you literally take a ball and you roll the ball along the floor, new points on that ball are going to contact new points on the floor as it progresses. Okay, that's your roll. Next, we have your glide or a slide. So with this one, there is 1 point on one surface that will contact new points on an adjacent surface. So your best example there to think of is ice skating, okay? The blade on the ice skates stays constant the entire time. That is one surface that does not change. And as you're going, as you're ice skating, that is going to come into contact with new points on the adjacent surface. Okay? That's your glide. And then lastly, we have the spin. So a spin is a rotation of a single point on one surface contacting a single point of an adjacent surface. Okay? So if you're spinning a top. Okay? So that's your spin. So these are all things that occur in our body in order to facilitate your osteokinematic motions. So these things are occurring in conjunction. Okay? So this is the most important thing from this entire lecture right here. Okay? So your concave convex rule. So this is why you have to know the shapes of your bones. Okay? Because for any given movement, you need to know if the concave bone is moving on the convex bone, or is the convex bone moving on the concave bone. Okay? Based on that information, you will be able to apply this rule and understand what is happening for the arthrokinematics. Okay? So, in terms of your actual rule, if a concave is moving on a convex, your glide is going to occur in the same direction as the distal end of the moving bone. Okay? I know that is not going to mean a lot to you right now, but let's just get the rule memorized. Okay, so again, concave on convex. The glide occurs in the same direction as the distal end of the moving bone. I don't, everyone's brain is gonna work a little bit different. The only way I was able to remember this in school was I always started in my head concave on convex, and concave has an A and same has an A. It worked for me. So find something like that that works for you, so you never question it moving forward. Okay? So that's for concave on convex. Now, if this is different, so if you have convex on concave, then your glide is going to occur in the opposite direction as the distal end of your moving bone. Okay?
Very vexing.
Very vexing. Okay, concave on convex is the same. Convex on concave is the opposite. Okay? And again, as we go through the next several units, we will apply this information. So it will start making more sense as we get into it. But right now, I just need you to memorize the rule. Okay? All right, so with that, we have your cards. All right, so first, let me get through the directions first, and then we'll have you divide. You are all going to divide up into your different colors based on your cards. Okay, so the blue cards are going to be lower extremity group, the red cards are going to be upper extremity group. Okay, and then from there, I want you to kind of subdivide into mini groups so you can actually discuss your cards. Okay, so looking at the motions on them, I want you to consider what osteokinematic actions are being performed. Okay, what plane or axis does that motion occur in? Okay, what are the shapes of the bone ends involved? Okay, are they convex? Are they concave? Okay, and then try to determine in your rule, is this a concave on convex motion, or is it a convex on concave motion? Does that make sense? getting a lot of blank stares. Someone ask a question if you don't understand.
Can you go over the first two things to look at?
So just looking at what osteokinetic motions are involved. And I understand some of the motions are gonna be more complex versus others, so you can break it down to however simply you need it. You know, look at one joint motion if you have several in your picture. Okay, so what osteokinematic motion is involved? What plane and axis is that occurring in? Okay, the shape of the bones, okay, bone ends, is it convex or is it concave? And then is the motion that's being performed a concave on convex motion or a convex on concave motion?
Great.
Sound good? And go. Concave mean, and you know your osteokinematic motion. Okay, so again, we're going to continuously build upon this through each unit. So make sure for right now, you understand the rules. Okay, I do want to give one quick example of what this would look like in the shoulder, since that's what we're going to next, and hopefully that will start maybe to help connect some of these dots. So for my shoulder, I have, well, what's my shoulder joint? Okay, but what's the actual bones that are involved? The humerus? What does the humerus articulate with? Acetabulum. Okay, so that's your glenohumeral joint, humerus and acetabulum. Okay, what shape is my humerus?
Convex.
Convex. What shape is the acetabulum?
Concave.
Concave. So I have convex on concave. I'm gonna move into shoulder abduction. So in shoulder abduction, which bone is moving? The humerus is moving, okay? So humerus is moving on the acetabulum. Convex is moving on concave into shoulder abduction, okay? So now, in terms of my rule, I have convex on concave, which means what? What is opposite? Don't just say opposite.
Opposite
Yeah.
way.
Distal end of the moving bone.
Direction.
Just moving opposite
Yes.
direction.
Okay, so my glide occurs in the opposite direction of the distal end of the moving bone. Okay, so in this case, my distal end of the moving bone is the distal end of my humerus. When I go into abduction, my humerus is moving superiorly, meaning my glide occurs inferior. Okay, so if I wanted to help to improve somebody's shoulder abduction, that's what they're coming to see you for. When I do my joint mobilization, I'm going to provide an inferior glide at the shoulder in order to help restore shoulder abduction. Okay? Does that make sense?
Mhm.
So that's what it would look like, you know, when you're actually applying this information. Okay? So as we start to learn things, you can start thinking through those. All right, we're gonna move on here, but again, we'll come back to this more, so don't fret if you still don't understand. Okay? All right, so just really quick, range of motion, this is going to be a main focus in next semester's class in assessment, okay? But for right now, I just want to introduce it briefly. This little tool right here is called a goniometer. It is what we use to measure your joint ranges of motion. So for this class, as we go through the different units, we are going to assign a specific number of degrees to each osteokinematic motion, okay? You have to memorize those for this class, and then we will work to learn how to actually measure them next semester. So again, this information builds, so make sure you learn those things down, okay? For example, again, keeping with our shoulder abduction, your normal there is 180 degrees. So that's what we would measure with this tool, okay? We have active range of motion and passive range of motion. Active range of motion means that an individual is doing the motion themselves. Passive range of motion means that you are moving the limb without their assistance. So they are a complete passive participant. You are looking at their available motion. Okay. There's also active assisted range of motion, where some external tool is helping them achieve that motion, but they are still actively participating. So So that would be one of the common things you'll see in physical therapy clinics is somebody taking a cane, laying in supine, going cane overhead. So they're still doing the motion, but they have an external device that's helping them achieve it.
What did you say that was called again?
Active assisted range of motion.
Thank you.
Okay. Okay, so with that, every joint also has a specific end feel that is normal, okay? So end feel is basically the type of resistance that is felt at that end range of motion, okay? So every joint has its normal end feel, okay? So your normal ones here are going to be basically this top row. So a hard end feel, a firm end feel, or a soft end feel. Those are normal. Okay? Then your bottom row is going to be abnormal end feels. Okay? Boggy, spasm, empty, springy. Okay? And then any of your normal end feels can be abnormal if they are found in the wrong joint or at the wrong time. Okay. So, a hard end feel is basically going to be bone. Okay, you have a bony stomp, you can't go any further no matter how hard you push. Okay, that's going to be something typically like elbow extension. Okay, you're all the way straight, no matter how much you push, you're not getting any further there. Okay, all of these things are assessed passively. Okay, so this is what you feel when you move a patient's limb. Okay, you're assessing how much motion they have and what happens at the end of that motion. Okay, a firm end feel is going to have a little give to it. Okay, so this is going to be more like a ligamentous type stomp. So if you think about something like the knee, okay, the knee is going to be most restricted in the extension by your ligaments. A soft end feel is either going to be muscular or adipose tissue. So a lot of people, like if you have really big biceps, okay, and you're coming into elbow flexion and your bicep is restricting your ability to go any further into elbow flexion. You got that problem? Yeah, me too. Okay, so does that make sense? Okay, or if someone has a lot of adipose tissue, you'll commonly see it in hip flexion, let's say, where if they have a really big belly, their hip can't flex anymore because of the belly, not necessarily because the joint itself is actually restricted. Okay? Coming down to these ones down here, boggy end feel is going to be like fluid, inflammation. So if somebody sprains their ankle and they have, softball size swelling around their ankle, and you can really feel that fluid. That's going to be a boggy end feel. Spasm is literally a spasm, so some type of muscular spasm that is restricting your joint range of motion. Okay? Empty end feel. This one is important for us. Okay? This is going to be when the patient stops you. Okay? Whether they're in pain, whether they're fearful, no matter the reason, they are saying, hey, you're not going any further. Okay? So you're not truly assessing the actual end range of motion. Okay? Because you're being stopped. Okay? And then springy, this is one that you don't quite see very often, if ever. This would be if somebody had like a cartilaginous tear or something like that in their knee, let's say, and you could feel where it's almost like a rebound, like you get to the end range of motion and the joint rebounds. Okay. All right, so again, this will be important information as we progress. So for right now, let's just learn the definitions and what they mean. Okay, and then we're just going to do, again, just kind of a quick review on basic science information that we likely haven't talked about in quite some time. So, Newton's laws of motion. Who knows them? I was going to say.
Sorry.
I think we probably have one. All right. Law of inertia. What is it? Okay.
That's
At least read it. Okay, an object stays at rest or in motion at a constant state unless acted upon by an external force. Okay? The second law of motion is the law of acceleration. Okay, what's the law of acceleration?
Force is equal to motion to, force is equal to motion in mass.
Alright, law of acceleration. This is going to describe the relationship between your force, mass, and acceleration. Okay? So force is going to equal mass times acceleration. And then we have the law of action-reaction. Okay? This is probably the most common one you guys should know. So for every action, there is an equal and opposite reaction. Now when it comes to equilibrium, okay, these are going to be a little bit more important concepts when it comes to treatment of our patients, okay? So starting first with your center of mass, okay? This is going to be the point where the sum of the mass of all body segments is located, okay? So this is something that can actually change dependent on body position, okay? The center of gravity is going to be the point where gravity acts upon the center of mass. And then your line of gravity is going to be an imaginary line that vertically passes through the center of gravity towards the center of Earth. Okay? So again, these are going to be important when it comes to being able to determine a patient's equilibrium. Okay? We also have here what is called the base of support. Okay? So this is basically the area that is in contact with a supporting surface. Okay? So if you stand, you could either have a narrow base of support or a wide base of support. These pictures are good, depictions of that. Narrow meaning your feet are closer together, wide base of support meaning your feet are further apart. So again, you can go through all different types of body positions and consider, okay, is this a narrow base of support? Is this a wide base of support? How could I change the base of support to either make an activity easier or harder based on your patient's current function? Okay? So the interaction between your base of support, your center of mass, your center of gravity, all are going to contribute to the stability of an object. Okay? So that is, I think there's a good section in your lab manuals that deals with this. So again, we'll go through this a little bit more in lab. But, just conceptually, if you have a larger base of support, if you have a bigger area of contact on the ground, that is going to be a more stable position. Versus if you have a narrow base of support, you pick up a leg, you're standing on your toe, that's going to be a lot harder to maintain stability. Okay? And then just a few terms here regarding your types of motion. Okay? So starting first with linear motion, this is also called translatory motion. Okay? This is basically just something that occurs in a straight line. It goes from one location to another. Okay? So very straightforward. We have two types here, so linear and curvilinear. Okay? Or, yeah, rectilinear, curvilinear. Okay? So rectilinear motion, basically just a subcategory, but that is still movement in a straight line. Okay? Versus curvilinear is going to have a more of a curved path. Okay, so your linear or rectilinear motion is going to be your example down here, riding a bike on a straight path. Okay, versus kicking a soccer ball, you have that curvature of the ball. So that's going to be a curvilinear motion. Okay, but not something that is circular. Okay, you just have an arc or a curvature. And then we have angular motion. Okay, so here you have movement of an object around a fixed point. Okay, so that's going to be more rotary. So that is really what you will see the most of in regard to the human body. Okay, because again, like we said, all of your motion is occurring around a fixed axis. So basically every motion in our body is going to be more of an angular type motion. Okay, you do have a slight, what you could probably justify linear or curvilinear with the scapula if you're just going into straight scapular elevation or depression, but even with that you have the shape of the rib cage, so there is technically a slight curve to it. But that's the closest thing to linear that you'll really get in the body. Okay, so with a little bit deeper into angular motion, with this, all parts of the object are going to move around the same angle in the same direction, but they don't necessarily have to move the same distance. Okay? So again, with angular motion, you have the same angle, same direction, but not necessarily the same distance. Okay? So if you think about if you're just like sitting on the table and you kick your leg straight out, okay? Or if you're straightening it, if you're bending it, it doesn't matter. Okay? So with that, your knee is going to serve as your joint axis, okay, your axis of motion. But your foot is going to travel a further distance as compared to, let's say, the top of the tibia, the tibial tuberosity. So even though everything is moving together, you're moving the same direction at the same time, your foot is having to travel a further distance because it's further from that axis. Okay? All right, so again, most of the motions of our body are going to occur in an angular motion. Okay. Last, more physics type thing here is going to be your levers, okay? So again, this is something more so that you could probably memorize and dump. I don't say that often, but this is not something we're gonna come back to in the future, okay? So, for now, just understand your concepts. What is a first class lever? What is second class? What is third class? How you can relate that to the body the best way that you can. And then we're never gonna talk about this again, okay? So, a lever. It is going to be described as a rigid plank that can rotate around a fulcrum when a force is applied, okay? So, in each of your different types of levers, you have a fulcrum, which is going to be your axis, so that's your little red or orange triangle down there. A force, which is going to be applied to the lever, and then the resistance, which is going to be your load, okay? So, in the human body, your joints are going to be your axis, your bones are your levers, and then the muscles are the forces. Okay? So, in a first class lever, you can see these are good diagrams to understand where your fulcrum is, where your load is, where your force is. Okay? In a first class lever, that's this first one right here, your axis or your fulcrum is going to be located between the force and the resistance. Okay? So first class levers are going to favor speed and distance. Okay? If the axis moves close to the resistance, then that means the resistance arm will be shorter and the force arm will be longer, so it would be easier to move the resistance. Okay? In a second class lever, the resistance is going to be in the middle. Okay? The axis is on one end, the force is on the other end. Okay, so your best example here is going to be a wheelbarrow. Okay? In the body, like if you want to apply this to the human body, it'd be the same thing like if you were standing on your tiptoes. Okay, so if you go into a calf raise, so your force there would be provided by your ankle plantar flexors. Okay, second class levers are going to favor power. All right, and then we have
power?
power.
Favor.
Mhm.
Favor, they'll
Favor.
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 They'll most likely.
And then a third class lever. Here the force is in the middle with the resistance and the axis on the opposite ends. Okay? This is going to be the most common lever in the body. Okay? Elbow flexion can be a good example to consider here. So you have your axis at the elbow joint, your bicep would exert the force, and then your resistance would be the weight of the forearm. Okay? Advantage of a third class lever, this is going to favor, again, speed and distance. slide here we have is kinetic chains. Okay, so we have closed kinetic chain and open kinetic chain. Okay? Do not confuse these with the open packed position and the closed packed position. Okay, that happens every year. Two totally different concepts. Okay? So, open kinetic chain and closed kinetic chain. So, a closed kinetic chain, your distal segment of a motion is fixed. Okay, versus open kinetic chain, the distal segment is not fixed. The proximal segment is fixed. Okay, so these are the two easiest examples to see what that looks like. If you're doing a squat, your feet are fixed on the ground, your feet are not moving, everything proximal to it is what's moving. Okay? Versus your open chain, you're sitting on a table, you're kicking your foot out. You're kicking your foot out. So the foot, the distal end is not fixed. Okay, that is open versus closed chain. This is important now when we apply this to your arthrokinematics. Okay? Because if you have to think about what is occurring in your motion, you need to know what bone is moving. Okay? And that's gonna change if you're in an open kinetic chain position or a closed kinetic chain position. Okay? If I'm in open chain, my tibia is moving on my femur. If I'm in closed chain, my femur is moving on my tibia. Meaning at the knee, at the exact same joint, this could either be in closed chain, it could be a convex on concave motion, versus an open chain, it now turned into a concave on convex motion. Okay? Does that make sense? Any questions there? Any questions at all? Okay, so big highlights from today. Make sure you understand the shape of your bone ends, so we can apply the arthrokinematics, memorize your concave convex rule. Those are our priorities, let's stick with that. And then we'll build upon that come next week. Sound good? One more thing I wanted to mention today, I should have at the beginning, but I wasn't thinking about it. Make sure for these lectures that you're not just looking at them in the preview mode on Blackboard. So make sure you're actually downloading them and saving them, so you have them, you can take notes on them, because a lot of our courses, we run out of space in them. So, you know, after a couple weeks, depending on the instructor, depending on the course and how much space the course has, we may have to go back and start deleting things. So, save them now, so you don't run into any issues later on. Okay? Does everybody know their lab groups?
Give or take.
Yep. Okay? Anything else? How do you feel today? After that? Better or worse?
Better.
I had more fun than yesterday.